Hi, I'm Dr. Michael Valentine, and you're probably watching this video as a result of coming to our website and being concerned about peripheral neuropathy. Well, we're here to tell you that you don't have to live with peripheral neuropathy. You don't have to live with burning pain, the numbness, the disability that comes with peripheral neuropathy. I'm sure that you have had peripheral neuropathy, and you might have had this starting in one foot or in both feet, and it might now have also moved into the hands as well if it's progressed, as typically peripheral neuropathy will do. Peripheral neuropathy means that basically the nerves are no longer functioning properly. They're no longer communicating. The nerves are basically dying. They're no longer to feel the sensations in that. Now, why do you have pain? Well, because the receptors are no longer working. So you might be on some medication. You might be on Cymbalta or some other drug that is designed to lower the frequency of firing in your brain. So your brain is actually not communicating. So you don't have that sensation. And even then, you'll probably be noticing that these type of symptoms are not, or the medications are really not improving your symptoms. You might have problems sleeping at night. You might have problems where you're losing track of where your feet are as far as when you walk, where you stand. You might be having complications like balance problems as a result of the peripheral neuropathy problem. And it gets frustrating. You wonder what to do. You've probably been to the medical doctor or medical doctors. You maybe been to your GP. You might have been to neurologists, and they have no solutions for you. So they kind of say, well, live with it, or they keep on putting on one drug or another drug to see what is going to give you the best benefit as far as the medication. And if that works, typically it's not enough to really give you the complete removal of your symptoms, but maybe just some reduction in the type of symptoms you have. So what makes us different is that we look at the peripheral neuropathy problem not only from a neurological standpoint, but we're looking at it from a sugar regulation standpoint, and we're looking at it as a circulation type of problem beyond that. When we look at this peripheral neuropathy problem, we want to identify, one, is it something that we might be able to help you with? Because it's not worth your time or our time, obviously, if it is something that we would not be able to help you with. And obviously, we do not accept all patients. We only accept those individuals that we truly believe we can help. So peripheral neuropathy, in our office, we've had great success with the peripheral neuropathy individuals, helping them to receive relief of peripheral neuropathy, the burning type of pain that they have, in a matter of a few sessions, where they're significantly improved, and they're very happy as a result of that. So we hope that we could be of the same service to you. What I'd recommend, on the right side of this website, you'll see an area that you can fill out your name, your address, and your email. And with that, we'll go ahead and send you a more detailed DVD that goes into the aspects of what we do in our office, in particular for peripheral neuropathy patients. Now understand, not every peripheral neuropathy patient is the same. Even though the symptoms, you might talk to someone else that's had it, not everyone is going to have the same exact type of scenario going on, and it's not going to necessarily be the same solution as far as resolving those symptoms. So when we look at you, we look beyond the diagnosis as far as peripheral neuropathy. We look at you as far as what's going on in your body that has been attributed to that. That's why it's very important that we get a comprehensive history and other environmental factors that you might have been exposed to, as well as your diet habits, as well as any other type of factors that might be involved that might be making this condition worse. So as a result, go ahead and fill out that form like I mentioned on the right hand side of this website, name, address, email address, and we'll get that information out to you as soon as possible. Thank you.